Dr. Rich Castellano, the Smile Doctor here. Thank you for letting us share your video today. We're going to be doing some of the Bellafill and the eyelid treatment. So we've got everything all set up here. Now, Tracy, let's take a look. Hold this for me. And we got her tethered on the blood pressure cuff, so let me undo this for you. And so I'm going to use my little white pencil. And we're going to review. We talked about a few of the areas that you wanted to treat the creases. We can't take them away 100%, but we'll improve as much as we can through here. And then I'm going to do a little bit in the cheek. We're going to do a couple syringes today. Now I'm doing this in the cheek. I stay about 5 to 10, that's almost a full centimeter below the orbital rim. I stay about 5 to 10 centimeters below the orbital rim, so we're really building up in the cheek with the Bellafill. And then we're going to come back and do a little bit more, but for today we're just doing 2 Bellafill syringes, and then we're refreshing the eyelid skin here. Any questions about our goals for today?
What about the...
So do we have the, so I can put a little bit of the filler in this area. So I'll put just a little touch of the filler through there, and then we'll, we're going to do the eyelids as well. So that's our plan for today, okay? All right. So what was it, I'm curious, what inspired you to have a cosmetic treatment done?
My droopy eyelids.
Is it something you've been thinking about for a while?
Yeah.
Well, you've come to the right place, and we do a muscle sparing technique. So we leave the muscle, we leave the fat. You don't want to prematurely hollow the area. We're all going to get hollow around our eyes as we get older. When you take skin only, it preserves the volume, and there's less recovery. So it's just a little one stitch. But for now, I'm going to use some of the numbing medicine, and Yesenia has everything set up perfectly for us. I'm wearing my Stop and Smell the Roses suit, because we do need to stop and smell the roses every now and then. And Tracy has some, can we show them your boots, Tracy?
Yeah, I have those.
You got to look at her boots.
Just Stop and Smell the Roses boots.
Stop and Smell the Roses boots, too. And we did not plan that, but our vibration is there. So we have the best patients. Who referred you to us, Tracy?
Nancy Anderson.
Okay. So let me have you rest your head. I'll hold her back. So we have a lot of our patients that once people come in, their family and friends follow. So I'm going to use the lidocaine, and I like to use the buzzer as well. So Yesenia has everything set up perfectly. So you're going to feel buzz, and then pinch on 3. 1, 2, 3, pinch. Little pinching there. 1, 2, 3, pinch. Sorry, a little pinch. Let's take a little break. I'm going to turn this up just a little bit. You feel that getting a little bit numb there? How about here? 1, 2, 3, pinch. Let's give that a moment. Okay, let's take a little break. We'll give that just a moment to settle in. There's no restrictions after the fillers. With the eyelid treatment, when we trim the eyelid skin, my little one stitch technique, you feel buzz and then pinch. 1, 2, 3, pinch. Little pinch. 1, 2, 3, pinch. There's no physical downtime with the eyelids, but socially you'll have some swelling for 4 to 7 days. And then a little bit in the corner of the mouth. 1, 2, 3, pinch. Okay, let's take a little break there. Now I'm going to test the numbing on the other side.
Boy.
Are you feeling any pain right now? Just the pinching initially. So let me test these areas. Now, do you feel a little bit of pinch here? Small, medium, big? Not too bad? Once you do the initial pinches, you really don't feel that much. How about here? Do you feel a little pinch? Small, medium, big?
Not like before.
Okay, not like before. How about here? Small, medium, big pinch? A little bit there. Okay. I'm going to be doing an intradermal injection, and that is to thicken the skin. So you can't take the creases away 100%, but you can soften them considerably.
Oh boy.
Now, how about now? Do you feel a little pinch here? Small, medium, big pinch? Not too bad?
A little bit.
How about here, small, medium, big?
A little.
Small, medium, big pinch? Not too bad? Okay, so I'm going to do some of the numbing here for the glabellar line. You'll feel buzz and then pinch, 1, 2, 3, pinch. Sorry, that one's a little more tender. Okay, let's give that a break.
Oh my goodness.
That one is tender, that one is tender. Now, are you feeling any pain right now?
I don't think so.
Okay. So we're going to give that just a moment to settle in. Is that tender when I push or not really?
I can feel it a little bit.
Just get that numbing medicine to settle in. How about now? Are you feeling any pain right now?
Well, you're not poking me, so no.
Right, but the numbing medicine
It
does its
feels
job.
like
See,
it's
like right
numbing.
here, do you feel any pain there? Not really. So once the numbing medicine settles in, you really don't feel much of anything.
Okay.
Now you feel a little bit of a pinch here. Small, medium, big pinch, not too bad.
Not really, just pressure, I think.
You'll feel some pressure, so a little bit of the numbing medicine. Thank goodness for lidocaine. How about here? Do you feel pinch? Small, medium,
No,
big, little bit?
Not really, just
Are you feeling
pressure.
any pain or just pressure right now?
Big pressure and a little like prick.
So that's the worst of it, right? The rest is a piece of cake. So now, in the corner of the mouth, you turn your head this way a little bit. So we're just thickening the skin. You feel a little pinch there, not too bad. And you can see how those areas plump up a little bit. We make the insertion point, that's where we're going to place the cannula. Very good. How are you feeling?
Okay.
A little pressure there. A little pinch there. The corners of the mouth. Make that little insertion point where we're going to place the cannula. Do you feel a little pinch here or not really? Small, medium, big?
Not too bad.
People obviously need to take caution when injecting into glabella. It's more of an advanced technique, but really people get into trouble when they get into the blood vessel. Midline like this, and when you're injecting intradermal, you can't get into the blood vessel there. You really have to be into the blood vessel to cause trouble. So this is an intradermal injection. Everything's looking good. You feel a little bit of a pinch here or not really?
But not like, oh my God, pinch.
Yeah.
Okay.
Are you feeling any pain right now?
No, I don't think so.
Everything's looking good. I'm just going to hold some pressure. We hold some pressure where the
Okay.
potential for bruising is. And I don't see any bruising, but we're done in those areas. I'm going to do a little bit in the cheek. How are you feeling, Tracy?
Okay. What do you think about my chin where that crease is?
Well, now, so that's, if you want me to treat there, I've still got some I can treat a little. I just have to numb. Let me show you.
Okay.
Hold this for me. And I just get you
Oh, isn't that pretty?
Now take a look. Can you see how it softens in the creases? How does all that look so far?
Okay.
See the creases, how they soften through here? Do you like that? I'm going to treat a little here in the crease as well, but I just need to numb it, okay?
Okay.
A little in the crease, and then I'll do a little in the cheek. And remember, we'll still have some to come back afterwards if we need to add a little bit more. Sound like a plan?
Mm-hmm.
So let me mark. I always like to mark it out and make sure that we're on the same page. Okay, so it's right in through here. Why don't you take a look? So take a look right in this spot is where we're going to treat. Okay.
I mean, I think you know what you're.
Say that again?
I trust you to, like, you know.
We'll always
you
tell you
can
the truth.
Like a freak or anything.
We grab some of the gauze. Everything's looking good.
Jennifer says it's amazing. If she could see it already, it looks
Yeah, you
great.
can see a difference right away.
Mhm.
So this area, you're going to feel buzz, and then pinch on 3. 1, 2, 3. Pinch. Sorry, it's a little tender there. Okay, let's take a little break. Let's take a break, because that's a tender spot.
Mm-hmm.
So we're going slowly. Are you feeling any pain right now?
Mm-mm.
So we're giving it just a moment, and I'm going to go slow.
Ooh.
The tender to push on there.
Not really.
So we're going to go really slowly. Now, do you feel a little bit of a pinch there? Small, medium, big? Tell me what you feel. Pressure, pinch?
Mm-hmm.
Do you feel pain right now? Tiny pinch?
Mm-hmm.
Not too bad?
Mm-mm.
So we go slowly. We take our time. How about now? Are you feeling any pain?
Mm-mm.
Feel a little tiny pinch there. How about here? A little pinch?
Mm-hmm.
No, she hasn't had her surgery yet. She's about to do her upper bluff.
Little pinch. 1, 2, 3. Pinch. Little pinching there.
Mm-hmm. Mm-hmm.
We'll go slowly. And little pinch. 1, 2, 3. Pinch. Alright, a little tender. Okay, let's give that just a moment to settle in. So now, we're going to put some... Are you feeling any pain right now?
Mm-mm.
Okay, good.
Okay, like sleep.
Yeah, you can go to sleep. We'll wake you up when you're done. Okay, so for the...
Upper eyelids. We're going to be doing her upper eyelids here in a few minutes.
You feel a little pinch there or not really?
Mm-mm.
So as I tell patients, you don't want to taste the chocolate cake before it's done baking. We're going to inject it now. The swelling's going to settle. The collagen's going to build. And then at 6 to 8 weeks with the filler is when we're going to see our results. So even though I can soften the crease, I can't take it away 100%. But this is an intradermal injection to get that crease to soften. If we want more improvement than that, you know, you can use hyaluronic acid fillers. But we try and get the best result we can with the permanent filler. So let me show you what we've done so far.
Si las consultas son gratis y te dan los precios por ti cuando llama a ImageLift. Los números están en imagelift.com.
Yeah, my front teeth feel a little numb.
Your front teeth feel a little numb, and that's normal.
Yeah.
We're not doing any dental work today. No root canals.
Y no
Thank
cuesta
God.
nada para los consultas.
Very good. So I want to show you what we've done. So take a look. So we treated across that crease. I can't make it gone, but now that we put the filler there, we'll let the swelling settle. We'll see what it looks like. We can always add a little more. We treat it here, around the mouth, the chin, and then I'm going to do just a little touch in the cheek, okay?
I don't want to touch it, but
How does it look so far?
I think okay. It looks, it looks like a line that goes away.
This
Up
line here?
Up top,
Here?
yeah.
Yeah, that's gonna, well, that's your crease. Now, it used to be really deep. It's definitely gonna be better and it's gonna look natural, but we gotta let this settle, okay? And we've talked about how Botox combination filler does the best, but we'll do a little bit of the filler and see how far that gets us.
Okay.
And now just a little bit in the cheek, okay? Very good. One step at a time.
We're located in the Villages and in Tampa.
What was that, Yesenia?
They're asking for the location and telephone number.
Yeah, we're in Tampa and the Villages, Florida. You give us a call, 813-463-9245. We're on a mission to stop bad plastic surgery. I'm going to turn your head this way just a little bit. So I'm staying 5 to 10 millimeters below the orbital rim. And we're just building up the cheek, the bottom of the cheek here. You feel a little, it'll feel numb and goofy under the eyes. You feel a little pressure pinch there?
Like weird, like.
Feels weird. Are you feeling pain?
I feel the pricking, but it sounds crunchy or something.
Sounds a little crunchy. Are you feeling pain right now? Me neither. Perfect. Let me turn your head this way a little bit. Pressure pinch, pressure pinch. Pressure pinch. You'll feel a little numb and goofy under the eyes. This is 5 to 10 millimeters below the orbital rim. I'm staying in the cheek, but it still does a good job to help that infraorbital hollow. How is Tracy feeling?
I'm good.
Okay, why don't you take a look here? Can you see how it helps out the cheeks a little bit? So a couple syringes goes a long way. Now there's swelling. The swelling's going to go down. The collagen's going to build. And we'll take your before and after pictures at 6 to 8 weeks. But next what we're going to do is we're going to lay you back. We're going to do the eyelid. That doesn't take long. You did great. And thank you for watching. We're on a mission to stop bad plastic surgery. We're here to help you raise your cosmetic standards. We will see you in the next video. Thank you for watching. And your boots take the cake. The boots are